I'm joined in studio now by Dr. Anjali Taneja, Executive Director of Casa de Salud. Welcome.
Thank you.
Also, Dr. Susan Maraida, a resident family physician at UNM and former apprentice at Casa de Salud. Thanks for being here.
Thank you for having me.
Anjali, I want to start with you first. The Health Apprentice Program has been going for 10 years, but what was the need that the organization was trying to fill when it first got started?
Sure. So Casa de Salud is a nonprofit integrative health clinic in the South Valley of Albuquerque, and it started as a community process based on a need in the South Valley and beyond to provide care for accessible prices, and that was fair priced and culturally humble back in 2004. And it was brought together by Western medical clinicians, health promoters, promotoras, volunteers, as well as the Calpulli Izcalli, a collective of traditional Mexican women healers. And in those first couple of years, it became very clear that if we wanted to provide care for low cost to folks who didn't have insurance primarily, that we had to find ways to make this work without having a lot of overhead. And there were a lot of students interested in the health professions who were people of color, women who weren't very well represented in the medical and healthcare fields. So we created a volunteer program where volunteers from colleges or otherwise and work-study students through the AmeriCorps UNM Community Engagement Center program could volunteer time with us. And that helped save money for the clinic, but also provide a really transformative experience for folks who are interested in healthcare in a community-rooted grassroots environment.
And speaking of transformative, Susan, I hear that you got your start there. Were you interested in medicine before you became an apprentice?
I was toying with it, but Casa de Salud was really my first exposure to any kind of medicine, and my first exposure to family medicine and community medicine. And I really fell in love with it. I fell in love with the model at Casa de Salud. Some of what Dr. Taneja was saying about the blend of traditional and Eastern practices of medicine, as well as the community, really. I felt right away like these were my people, like these were really cool family physicians. They were young, creative individuals who were trying to care for the community in the best way they could at a low cost.
And so you went to UNM.
I did.
And so did you immediately start to pursue a path towards medical school?
No, actually. I took kind of a broad array of classes. And it wasn't until my sophomore year, after hearing about Casa de Salud from another community organization, that I stopped by and really put my foot in the door and found out that they were accepting new volunteers. And I stayed there for 4 years.
And so as you went through medical school, I'd imagine there are some different value sets and some conversations about how to provide medicine. And did you feel some tension in kind of what you had gotten excited about at Casa de Salud and what people were talking about in medical school?
No, not really. I think UNM does a really good job of providing family medicine and primary care in general as something that's common and very needed, especially in New Mexico. And so, whereas I think other medical schools may not value those primary care tracks as much, I think UNM does a really good job of promoting that and for providing experience for the med students. That being said, I think that my preclinical experience at Casa de Salud was vastly different from many of my classmates.
Interesting. So Anjali, one of the goals is to get more diverse folks into the medical field. How does the apprenticeship program make that possible?
Sure. So just speaking of diversity, in the U.S. right now, between 6 and 8% of physicians are Native American, Latinx, or African American, and that doesn't represent the population in the U.S. In addition, there's a privilege problem in healthcare where a lot of current medical students come from families in which there is a physician in the family. that skews definitely where folks want to practice, what kind of medicine they want to practice, and what access points there are for folks who are not in the more affluent, more privileged sectors of society. And the Health Apprentice Program is dedicated to our community. We're a healthcare workforce development program, a pipeline program to various health professional fields, including becoming physicians, nurse practitioners, physician assistants, nurses, allied health professions, occupational therapy, physical therapy, but also public health and law school and other areas where this kind of experience can help transform the kind of work that folks want to do. But currently and in the past, 80% of our health apprentices are women, and 80% of our health apprentices are people of color from the community. So we are part of the response to this privilege problem to try to shift more diversity, to bring more diversity into healthcare fields, but also to bring more of a diversity of experiences and understandings of broader issues like community conditions and social determinants of health, and bring people into healthcare schooling who already have experience in anti-racist settings and in culturally humble settings where they're providing care with dignity and understanding that you can build and run an organization with integrated healthcare pieces in a nonprofit way out in the community, something that when I was a medical student, I was told that this kind of work is not really possible.
So it's great for those students who are kind of tracking their career, but how does it help improve medical care to have those diversity of providers with different experiences that can relate to people? How does that make sure that we're providing better medicine for folks?
So study after study has shown that based on the ability of a patient to connect with their provider, that results directly in things like adherence to medications, in relationship building, in trust building. We have a history in the United States of amazing progress in healthcare, some of the best in the world, but also a history of eugenics and racism and colonization and the ways in which the medical industry has participated in that. And there's trust issues. The Tuskegee syphilis study, numerous other studies where people were experimented on, even in New Mexico. So building a diverse healthcare workforce has very real consequences for providing care in terms of trust building, relationship building, but also in terms of where people want to practice and the kind of populations that they want to work with and what they want to make possible for themselves and what they imagine is possible in healthcare. And we've seen numerous graduates of our health apprentice program go on to become clinicians, do other transformative work, and stay in New Mexico and stay committed to this state, which has a huge brain drain problem and also has the oldest physician workforce in the country, which means that the primary care shortage here is only going to get worse unless we put more effort into keeping folks here.
Susan, I saw you nodding. Do you want to add something?
Yeah, no, I do. And I've seen, because there are a number of former apprentices that are now in training programs, in health professional graduate programs at UNM. But I think another important aspect of, I guess, the exposure early on at CASA, and just in the community serving a predominantly underinsured, uninsured, predominantly Spanish-speaking population, is that we take that knowledge with us in generating our care plans for when the patients leave the hospital. So we anticipate a little bit better, I'd like to think, or at least earlier on in our training, what barriers they might face, whether in transportation to pick up their medications at the pharmacy, whether they can continue to take those medications depending on their type of insurance or if they have insurance, and then all the other social determinants of health that affect their ongoing health, including having a primary care physician to go and see after leaving the hospital. So I feel like we have a better understanding seeing and working with these patients before med school, such that it frames our ability to help guide their care.
Yeah.
I'll also add that most of our patients are monolingual Spanish speaking. So health apprentices who are fluent in Spanish get to practice their Spanish and work with patients in a way that they're speaking right away in their preferred language. And our health apprentices are all Spanish proficient. Our health apprentices also run our syringe exchange, which is housed in our clinic and allows folks who are actively using IV drugs to be able to receive new unused needles to shoot safer and to potentially explore treatment options in a dignified manner. That kind of culturally sensitive care without stigma, those are critical skills that students go on to healthcare schooling with and have before they've even walked into medical school or nursing school or anything else. In addition, we have other pieces of our work, including advocacy and medical debt navigation for folks who have overwhelming hospital and emergency room bills. And our apprentices come out with the knowledge of how to navigate the hospital collection systems and financial systems in a way that other students might not get. So the range of experience and what that means in terms of who folks can become as practitioners and their understanding of the conditions in the community is really incredible.
Are you going to stay in New Mexico?
I definitely am. Yes, there will be 1 year where I go off, but I'll definitely be back.
What do you think is the importance of that? We're talking about the brain drain and people leaving, of having folks like yourself stay, who've had this experience, who've been growing not only, your community experience, your knowledge, and in their schooling, and stay here and work in the community.
How important do I think it is?
What does that mean to you?
Vital. I mean, so not only does that benefit our community in the immediate by having these people who know the community, who have worked within the systems here and trained, but I think it's also important in making sure that we continue to have providers who want to do the same and who can see this as a viable career path and see that there are people who are doing really neat, really cool, creative things within fields that are traditionally undervalued.
Okay, so Anjali, you were saying, you've made this work in this nonprofit model that some people told you couldn't do, but I imagine you maybe want to grow it a little bit. What would it take? What are the barriers that you're facing right now in growing the program and creating even more opportunities for apprentices?
Sure. And I didn't create the program. I'm helping to lead the organization now in the last few years. But I have been working with apprentices on and off since 2009. Our health apprentice program, in the beginning saved us a lot of money because instead of having full-time medical assistants, we have health apprentices who we've trained who are committing 8 hours a week for an entire year, or in some cases like Susan or Dr. Moraida, committed 4 full years of volunteer time. That's over 1,500 hours to the organization in the setting of a medical apprentice. And so that was saving us a lot of money in terms of money that we could help save patients and keep our costs low for uninsured patients. But now we're so excited about this program that we've been building it, staffing it more robustly, and we're looking at transforming it into a full fellowship, which I would say it probably is right now if you look at the requirements and what apprentices do, but looking at a fellowship, possibly an academic partnership, and building funding and support for education, for structure, lots of different things, certifications, but also building out a health apprentice alumni network. We have more than 200 health apprentices who have committed a year or up to 4 years to CASA, some who've come on staff. We have 4 former health apprentices on staff now. Our nurse on staff is a former health apprentice, also 2 clinicians in the recent past and 1 in the future who is looking at becoming a clinician at Casa de Salud. This program costs money and requires a lot of oversight and support and mentorship, all of those pieces that really can help folks go from even high school, where we have some apprentices from, all the way through to their career goals. And so it's an ongoing kind of how do we make this work situation. And we have funding from a couple of wonderful foundations, and we're looking at building giving circles of community clinicians who care about mentorship and support, as well as looking to our Health Apprentice Alumni Network in the future, but finding creative ways that can be self-sustaining over time. So it's a huge challenge, but it's an incredible reward because I don't know of any other program in the country that is shaped like this, and that gives tools to apprentices to go on, not necessarily only to entry-level positions, but to full careers in healthcare and otherwise. So it's been a really rewarding experience, and we hope to expand it. It would be incredible to build a model for how other clinics around the state or around the country can take on this kind of work in this robust, structured way also.
I always love that when we're leading the way in New Mexico and challenging those narratives about our state. Well, thank you both so much for coming in and talking about the apprentice program at Casa de Salud. Appreciate learning more from you today.
Thank you.
you.